Good morning, everybody. Today we thought we'll discuss about commonly how a mother can be a doctor at home. That's usually what happens. Usually, a doctor is a mother at home. So I'm from Apollo Cradle, Jubilee Hills, and among Apollo children, actually we have Apollo hospitals, Apollo Cradles. I'm pediatric surgeon, pediatric lab urologist, and pediatric laparoscopic surgeon at Apollo Cradle, Jubilee Hills. So here in Apollo, our basic thing is patient comes first. So the treatment and care of a patient is the first priority for all of us. And as much as possible, actually, to our best effort, actually, we'll be doing a ethical and uncompromised quality care to the patients. So today our topic is about parents' role in child health. So in this topic, and we are planning to have a series of parents' role of in child's health. In this topic, actually, we are planning to deal with how a mother can be taken into consideration and how a mother can become something like a Dr. Sherlock Holmes. Sherlock Holmes is the one who has the best eye possible and the best brain. So, how a mother can be a Sherlock Holmes at home to increase awareness and encourage the dialogue about this topics. Actually, this is what is our main aim for the day. And childhood issues, common problems, and uncommon problems. This is what actually we are going to discuss today. And so, when we should be concerned, when a parent should be concerned, and when they should come to us for evaluation and care. That is what we are going to discuss today. And we have all pediatric subspecialties in Apollo Cradles, and actually we have excellent interdepartmental relationships. So with that, actually we'll be giving a very good comprehensive care to any patient who comes with any problem, uh, any child. So here, actually, our topic is actually when and how to meet, when and why mother should come to a pediatric surgeon. That's what we are going to. I'm going to deal in this present topic. So this is one common problem actually with most of us actually will be dealing with as a parent. So my child is complaining with recurrent tummy ache. So whenever tummy ache is there, there might be so many causes. So all these causes actually needs to be tackled one by one. Only then actually we'll be able to come to a proper diagnosis, proper conclusion, and give the best care to the child. So whenever the child comes to a mother and asks, actually, mommy, actually I have a tummy ache. So then, what I have observed in my 25 years of experience is constipation is one common cause for tummy ache. So whenever constipation is there, actually, child who is constipated, if he doesn't pass stools, it will lead to some vague tummy ache where he'll be holding his umbilical area, uh, belly button area, and then he'll be continuously crying. That is when actually maybe the mother who is experiencing with this constipation child will be able to understand actually yes, my child is having a pain maybe because of this. So just first thing that a mother should ask is actually, did you pass the motion today? So if she has not passed motion, actually then maybe a simple motion by giving one enema or one suppository, that is what is all the child is requiring to settle his tummy ache. So other common cause is actually what we have seen is mesenteric adenitis. In mesenteric adenitis, what happens actually there will be lymph nodes all around the tummy, and they'll be increasing in size whenever there's mild infection. So as infection subsides, the tummy ache also subsides. This is how actually we'll be able to give the diagnosis and proper care. So other common thing actually that most of the parents actually says is my child has got gastroenteritis. So gastroenteritis is one thing where whenever we eat outside or eat with unhealthy, unhygienic habits, so that is when actually your intestines will get affected with mild infection. That will lead initially with the pain abdomen. Later it will turn into vomitings, or after that actually it can go into uh, diarrhea as well. So other thing actually which we noticed actually common, these are the common things. So urinary tract infection. Sometimes when the child has got recurrent urinary tract infections, the child will have continuous pain, especially the just above the pubic area and below the umbilicus. So that is where what is because of the urinary tract infections. So whenever these problems are there, actually we need to tackle each of them in a different way. And sometimes the gonads actually are also go into torsion. Something like male in boys actually it can be because of the torsion testis, in girls it can be because of the torsion of the ovary. And appendicitis. This is one other common cause actually that most of the parents actually they'll be knowing about. And appendicitis is not the reason every time in any child who complains of pain abdomen. That is what actually all of us actually should understand in this talk. So other the common thing actually which kids try to conceal is fights or actually a violent movement actually which when he hit himself. Kid sometimes actually they just forget that he hit himself. So that is when actually we should actually take a detailed history and then actually we should be able to alert the family, alert the child or doctor. So actually, I'll go in a systematic manner. Actually, a child who comes with recurrent respiratory tract infections, on and off, actually, will be getting cough, cold, fever, and all. So the common cause for this is actually, first of all, basically, child might be low in his immunity. So whenever the child is low in his immunity, there is a high possibility that actually he'll be catching up infections as and when he meets any child actually or a friend who has some cough and cold. Sometimes they share, they shake hands and they touch each other without washing hands. So kids grow up with all these things, and then that is how actually their immunity will increase as well. And some common surgical problems actually that we encounter is if a child has got what is called as a diaphragmatic hernia or diaphragmatic eventuation, where the diaphragm is slightly high up, and lungs go into frequent infections actually because of the smaller space. And some lung congenital problems like congenital lobar emphysema, congenital adenoid malformations, or sometimes actually some sequestrations also can be there. So all these things can add to lung infections and lung compromise. So the treatment for all these things is early alert from the mother, early detection by the doctor, and early surgery by the pediatric surgeon will give a permanent solution. So at home, the first doctor is mother. So she should know little bit about first aid, and I'm not going to talk in detail about all these first aid topics actually because this is going to come in our next series. So the for commonly that they'll be falling, they'll be injuring themselves, and it can be sometimes sharp objects also, and sometimes it can be because of the workplace or actually we send them for some coachings and some dance, some gymnastics. All these places also actually they'll be having some injuries. So immediate first aid actually should be done by the first aid caretaker, but usually it is a mother at home. And sometimes actually they'll just have simple sprains also. Actually for those things also as well, actually some little bit of first aid measures actually parents should be aware of. So at home, actually each and every house should have their own set of rules regarding the safety, and be it actually at home, be it at a playground, or be it at school. So everywhere, actually the safety measures should be explained to the kids in detail. So for that, actually what we have to tell the parent child is actually first you should prevent uh, any accidents. So we have to prepare the child actually if at all if something happens, what to do and how to do, and how to respond, and how to recover from that major mental trauma. This all these things are actually should be taught to the family as a whole, especially by the mother to the child. So quite often, actually, most of the mothers tell, "My child doesn't eat at home, at school. The just lunchbox comes as it goes." So every mother wants the child to have a very healthy high diet. So for that, actually, we have to do give a good school lunch actually where which is filled with actually all beautifully decorated, well orchestrated and well balanced diet. So it includes all the carbohydrates, fats, proteins, and fruits. And if at all they like, actually they can add a little bit of egg as well. So burns is some other problem actually where first aid is very important. So whenever the burns happen, actually, whenever some fire accident happens, so all of us will tend to go into a panic. So for that, actually, a preparatory cycle is always important, and it should be taught well to the child and the family as a whole. So whenever actually a child actually meets with a fire accident, the first thing is stop the fire. So easiest way is actually roll the child in a blanket, and then after that actually fire will just disappear. After the fire comes down, immediately the whatever is hot over the body of the child or whatever he is touching, something like a metal, something like a shirt or his underpants, everything should be removed. And immediately what most of the things actually what most of us think is you should not put water, you should put oil. That is the wrong thing. In fact, you should reduce the heat by putting or pouring the regular tap water, not ice water or cold water or hot water, just regular tap water. So let it run so that the temperature reduces, so that a degree something we call degrees of the burns. So first degree, second degree, third degree. So most of them will try to stick on to first degree ones, actually, which are very easy to manage and which will give almost near normal results to most of the kids. And suppose when a burns happen, actually, we have to cover the burns area with some clinging paper so that there won't be much of water loss and heat loss before the baby is transferred to the hospital or doctor. So don't be in a panic to rush to the hospital. Actually, that is not important. First aid is the most important thing. And in this, actually, luckily, actually, what we do is collagen dressings. Actually, this with these dressings, the baby won't need any dressings for 2 weeks, and within 2 or 3 weeks, actually, everything will heal, and it will give the very good scar, provided it is a superficial first degree burn. So sometimes actually mother will be panicking, parents will be panicking what to do. My child has got urinary tract infections frequent, and sometimes my child is getting blood in urine, and some other related issues, or any child, any urinary tract infection in a boy or a child, girl, it needs evaluation, and later we have to go proceed accordingly. And another common cause that actually most of the parents encounter is bedwetting. My child still bedwets. Actually, I have seen one child, actually one of our patients, actually who was bedwetting even at 13 to 15 years of age also. So with simple home remedies, actually it can be done by mother at home. So with simple, we can give an easy solution for this simple problem. So even the child is in distress actually because he's bedwetting. He is also uncomfortable. So don't scream or punish the child actually whenever he does that. So try to understand this problem and then treat it in a better way, in a more motherly way. So behavioral therapy is what we call it. Actually, that is the remedy for nocturnal enuresis. And before we go for any of the medications, so medications are not the first line of treatment. So for that, what I usually tell is actually try late nights. Actually, often all of the kids actually nowadays they're getting addicted to this gadgets and TVs, and so late nights actually we should try to avoid at least for 1 hour before the bedtime. So that is why actually bedtime stories have been invoked since our ancestral days. Our grandmothers did it, our mothers did it, and we have to do it. There's no other choice. And try to teach actually some good moral values, moral ethics stories, so that actually child will be sleeping with that and maybe dreaming about that, and automatically his mind will be tuned very well. So late nights we should try to avoid coffee related toffees or cokes or drinks. So all these things actually they'll try to increase the bladder stimulation, and then he may be by able to, he may be having the urge to pass urine in the late nights. So other thing actually I often tell most of the parents actually even something like a Tom and Jerry. Tom and Jerry continuously they'll be chasing each other. So this is a very scary thing for any of the families, any of the child. So suddenly actually when Tom wants to catch the Jerry, that is when actually the baby will be passing urine. So try to reduce the fluid intake after 6 or 7. Restrict to 1 glass of water, and ask him to pass urine every hour from 6, 7, 8, 9, 10. And maybe at 3 o'clock you can wake him up at once, and 6 a.m. as well. Actually, you can wake him up once. So by doing this simple remedies, actually you will be able to um, find a solution for these problems. So puberty-related issues are some other common things which unfortunately most of us don't talk to our kids. So whether it is taught in the school or not, as a parent, as a good mother or father, you should be able to talk little bit about puberty-related changes and how it happens. So in most of the school going children. So all these things actually can be discussed. Actually, if you are not able to do it, actually as a pediatric endocrinologist or a pediatric surgeon, we can do it. And same time, actually, we have to observe some swellings or anything in the breast. Actually, all these things we should be able to observe and take notice of the doctor. Actually, as a pediatric surgeon, we'll be able to tackle that. So other common thing actually that sometimes very rarely, but actually, but sometimes it can be encountered is precocious puberty. My baby is growing actually a little bit of breast engorgement is there, and sometimes actually they'll be having pubic hair or axillary hair or something like that. Sometimes it is alarming that actually it can be because of that some tumors in sex hormone producing organs. So these things should be alerted immediately. We involve the pediatric endocrinologist, and as a pediatric surgeon, we'll be seeing that, and then actually we'll be giving the right solution in the right time. The moment it is removed, actually it will be better. Sometimes they come very late, actually after the voice change happens. If they come in a girl, then actually it is not a right time to do that. And I always tell most of the parents, involve your kids in healthy habits, be it eating, be it with the personal care, be it at the care at the school, or how to manage your peers and how to take care of the peers also. It's not directly you are trying to be safe from the peers. You should take care of the peers. That's as well equally important. So, so being a pediatric surgeon, I saw many parents actually who come with the child being prepared very well for the surgery. Some parents are really good, actually they do an awesome job, and it all depends on the age of the child. Something like a SM, 3, 4, 5 years old child, maybe a teddy bear actually who is his favorite teddy bear is an example. You can use that and you can tell that if your teddy bear has got this problem, he has got a hernia, so we are going to take the teddy bear to that for that reason, and then we are going to give a solution for the teddy bear. So then you can play very well with the teddy bear. So this is how you can explain. Maybe if it is a bigger child, you have to tell it in a different style. So this is how actually we have to deal with the kids, and then prepare them for the problem and tell them that you need not explain, you need not show. Sometimes actually some parents actually are quite bad that actually they'll show the complete video of the operation, which is easily available in YouTube's, but that is very unfair because actually you can't scare a child. You have to just teach him and see that he comes prepared for a friendly environment where all of us will be taking care in a very good way. So, so all of us want to prepare a child for school by the time actually he reaches around 3 years of age. So only if the child is completely ready, then actually medically, then we'll be able to comfortably think about school admission, which school to join. So a child should go comfortably. He should not have inferiority complex. He should be bold enough, and he should go without any breaks to the school. And that is what actually kids fear. Sometimes actually they are scared. Actually, teacher may scold me if I miss my class. So, and one more thing actually all of us should understand is kids don't remember most of the things which happen in the first 3 years of age. So, an operation which is done within the first 3 years of age is the best time because he literally doesn't remember anything. So that is the best part, and he won't have that fear. So once the kid goes to the school, actually a medical problem will become a open problem. Means including the teachers, including the colleagues, including the friends, including the IMers who are taking care of the baby. All of them will be knowing about the uh, issue. So let it be a family issue. Actually, let us solve it before first child goes to the school. So recently we conducted a school health camp. In that, actually, what these are all the problems we have found out. So we found out actually tongue is stuck in 4 kids, and we have noticed that squint is there for 3 kids, And there is one cleft palate which was unborn, unrecognized in one child. And we have noticed umbilical hernias, actually hernia in the belly button for 5 kids, and we have noticed 9 inguinal hernias and hydrocele. All these things actually I'll try to show in detail in the next coming slides. And phimosis we have noticed in 15 children, and prepucial additions actually that is noticed in around 25 two children. And in a history we found out that bedwetting is there in 6 kids, and testis was not seen in the scrotum. So he has undescended testis, what we call, in 8 parents, and one thyroglossus, which is a swelling in the neck, and 12 lymph nodes, which were significant. Lymph nodes will be there for everyone, but it's significant lymph nodes, means more than actually 1.5, 2 centimeters, something like that. And 13 kids, when we asked, actually, they showed us some swellings. And one child, actually, when we have palpated the tummy, actually, we found that a tumor is there for the child. And one child has got syndactyly, where the fingers are stuck. So that is seen in one child. And post burns, actually, after the burns, actually, there will be scarring. Actually, sometimes the fingers will be like this. So that we noticed in 2 children, which needed slight correction. So by doing the correction, then only he'll be able to handle the school activities and regular activities and peer issues easily. And in 2 children, we have been found out actually hypospadias, which is passing the urine from under surface of the penis. So all these things actually needs to be corrected and needs to be detected by home, at home by mother, and early detection. And the few come to a pediatric surgeon like us, actually we'll be taking care of that and we'll be giving a permanent solution. So with this, actually, I came up with some pediatric surgical checklist, and in our Apollo Cradles, actually, we have this pediatric surgical checklist. All our babies actually will be going through this pediatric surgical checklist. So before the child goes to the pediatrician's cabin, or before they come to us, actually all the sisters actually will be taking care of all the details. Something like whether your child has got tongue tie, whether the child has got any umbilical discharge, umbilical hernia, whether the child has got some groin or concerns, actually some like hydrocele or some swelling or any discharge or any swellings. So, and if the testis is there in the scrotum or not, and phimosis or prepuce is not going back, this we observe, actually sisters will observe. And hypospadias, where the child is passing from under surface of the urine, and if any of the swellings are there. With all these details, actually they'll be coming to us, to a doctor, actually before the child comes to the doctor. This luckily, parent satisfaction has increased a lot with this one in our patient parent doctor consultation. So recent concepts are actually of course, actually I'm trying to tell you a little bit more, actually whatever the doctor should be doing, telling you. So when to operate a child, actually sometimes actually mother will be noticing a problem, but sometimes actually they need not be operated immediately. Something like for a case of an inguinal hernia, a groin swelling, so which is coming and going. So it is a semi-emergency. Only if it is going into irreducibility, actually we have to operate. So we can't predict when the child is going to go into irreducibility. So that is why actually we operate early before it goes into irreducibility. Suppose, for example, a hydrocele, only water is there. Usually we give a time of 1 year to naturally regress. So if it doesn't regress, then only we'll operate. And the case of undescended testis, where the testis empty, scrotum is empty. I did not notice actually testis in the scrotum of my child. So that is when actually the parent should be alarmed. And for first 6 months, it's okay. And but after that, actually, if it is not coming, actually there is because of the damage, because of the temperature changes, actually there will be damages. So we try to operate within after the 6 months of age to 1 year of age. We'll be operating in case of undescended testis. Phimosis, actually the prepuce is not going behind. So that is why what we call it as a physiological one, especially if it is in the first 1 year of age. So till 1 year, actually usually we'll try not to do a circumcision. After 1 year of age, if it is still persisting, then we have to operate because it can lead to recurrent urinary tract infections. And I was talking about hypospadias, where the urine will be passed from under surface of the penis. So in this, we will be operating before the child goes to school. Sometimes it will require two operations, three operations, three stages. So that's why actually, and between the each stage, actually there will be 6 months gap. So that's why we try to operate one uh, from around the age of 1 year, and by the time actually he'll be around 2 years, actually everything will be should be completed. And cleft palate actually what because we noticed in that actually cleft palate we operated at 1 year of age, and nowadays the trend is going more towards early reconstructive operations rather than the stage one, stage two, stage three operations. So, but we'll be deciding actually according to the patient actually whether he requires stage operations or whether he requires one stage operation. So recent trends actually are changing from traditional many stages to single stage operations, be it anus problems or intestinal problems or urological problems. And we are moving more towards the laparoscopic procedures, and cystoscopy procedures are also actually conducted at the same time actually with while by passing some instrument through the urine hole, and then we'll be doing the full operation through the urine hole itself. So literally, there won't be any cuts on the bodies, and we'll be able to give the best scar possible to the children, especially with this laparoscopy and thoracoscopy procedures. So parents' role when it starts. If you ask me, actually, when the baby is in the womb itself, if at all, if the child is diagnosed to have some surgical problem, so that is when actually fetal diagnosis, what we call it as, and that is when the parents' role starts as a mother or as a father in decision making of the child's health. So whether they were, and sometimes actually we'll be talking about delivering in the right place, and if at all if we can do something actually when the baby is inside, or where we have to do, how we have to do, all these things will be discussed by a pediatric surgeon in the first consultation when the baby is in the womb itself. So let us come to the pediatric surgical topics. Actually, one by one, actually, I'll go through a little bit in this tour. So I was talking about a tongue tie. Tongue tie means tongue is stuck and then tongue is attached to the undersurface. When it is on the undersurface, actually, what we have to do is we will release in 1 year by 1 year of age, because that is when actually speech starts. So sometimes actually my parents must have noticed a small tiny hole in front of the ear that sometimes can go into infection. So that is when actually we detect, and before the infection comes, actually we'll be going for the surgery. So early surgery can before the infection sets in can lead to a better scar. Cleft lip, as I was discussing, at 3 months of age, and cleft palate actually will be doing operating at 1 year, and sometimes later actually they'll be requiring some surgical corrections. Thyroglossal cyst is one condition actually we notice actually a swelling in the neck, actually where we have to operate in the right time before the surgery starts, before the infection sets in. So, and sometimes parents have their own fears in the decision making. So please don't interfere with doctor's decisions. And this is a 4-year-old child actually with a vague history of fever and a vague history since 1 month. There is no history of any fight or trauma. And so later we found out actually we had it out actually is it a tuberculosis, is it a cancer or something like that. When we operated actually we found out that it is a simple pus. So abscess, that is what we call it as a pus. Actually, whenever the abscess forms, actually it needs to be drained. Means it is a pus, which is a dead organism, so it needs to be drained. If it is not drained, actually it will lead to what is called as an antibioma. So whenever we drain it, actually we put a needle first just to see if it is a hemangioma. Hemangioma is nothing but actually where actually blood vessels can be there in a bunch, and then that is when the child will be having too much of blood vessels. So this needs to be tackled differently. So luckily, actually, medicines actually like propranolol have worked wonders for all these babies. So from surgery, we have moved to medicines. This is actually an example of how actually a hemangioma can go. Actually, it literally disappears, and later actually baby will be able to manage with little bit of cosmetics or some other smile procedures. Scalds, burns, I was talking about. Earlier, we used to do regular dressings. Nowadays, actually, we're going for collagen dressings, which are really working wonders, and which is going to give a very beautiful scar. Intersusception is one condition actually which some parents will see. and where the intestines are going one into the other, actually, it is because of overfeeding. Overzealous mothers, actually, they want to give too much of food for the mother babies. That is when uh, child will land up in trouble, and he'll have sometimes they'll have to go for surgery. So before surgery, we are planning to do what is called as a hydrostatic reduction, and it is reducing. It is literally removing the scar from the abdominal body, abdomen. So in our school-going age, what we see is called transient interception. Ultrasound says actually transient interception. It will lead to pain abdomen. Continuously, baby will be crying, and for this, the treatment is just wait and watch and treat the cause. Usually, it is a gastroenteritis. So constipation is one common problem actually which most of the parents ignore. So the treatment for this is fiber, fiber, fiber. Fiber is there only in green leaves, vegetables, fruits, and your baby should be drinking adequate water. And constipation is one of the most common cause for the pain of the in children. Hernias are protrusion of the intestines which comes from any of the holes which are seen abnormally in the body. So it can be inguinal, it can be in the umbilicus, or it can be above the umbilicus. So here we are seeing a supraumbilical hernia. So all these things, hernia needs to be tackled. Actually, there is no medicine which can treat settle a hernia. So umbilicus is one thing actually which can give us actually so many clues about what is happening. So in the newborn period, it can be only because of granuloma. In the after the 4 months of age, if the child is having some weeping umbilicus or some pus or discharge or anything, that can be because of the some common connections which the baby will be having from the mother's womb. So let them be vitreointestinal duct or patent urachus. So for all these things, actually, we should be tackling the problems. So I'll talk a little bit about some pediatric urological problems that we encounter. Something like labial adhesions, actually, where the intestine labia, two labia of the girl, actually, they'll be adherent to each other. So that can be tackled by simple office procedure. It will be coming, and then we can see. So this mother only can see it. Actually, as doctors, actually, we cannot see it directly. So mother should notice this one. Phimosis is the other common problem that most of the parents notice. So there can be sometimes ballooning of the prepuce. So that is when actually surgery is required. So we will decide actually whether the child requires surgery or not. So every urinary tract infection actually needs evaluation. So circumcision is not enough. Actually, we have to tackle it in a different way. So it can be because some days it can be because of the vesicular reflux, or it can be because of the infection. So we have to tackle it in a different way. And for all these things, actually, we have very minimal procedures nowadays. Hypospadias is the other thing actually I was talking about. Send the child confidently to the school before the child goes to the school. And sometimes actually mother might be noticing when abdomen, seeing the abdomen, the child is having infections, child has got a swelling. So it might be because of the block in the kidney, which can be tackled, and we are doing it laparoscopically successfully. And hernia is one problem actually, but sometimes actually some parents might be noticing. So we need to tackle it as soon as possible. So it can be on one side or both sides. Laparoscopy is the answer. So with this, actually, we are able to cover actually most of the problems. So it's sometimes a hernia can be a semi-emergency. That is when actually we have to tackle it immediately. So, I'm again insisting. Actually, mother is the first doctor, and as a mother, actually, she should be able to recognize all the common problems actually that we encounter, and she should come to a pediatric surgeon and let her uh, check, and then come to a pediatric surgeon, and we'll be giving the best solution possible for the child. And this is how actually I'm insisting that actually mother is the first doctor at home. So, alert mothers can save a kid, and early detection of the problem, early solution for that problem is what is expected from the family, and that is what is the best for the child. And pediatric surgeon can solve all these surgical problems with his expertise. And the kids need that special eye, which as a pediatric surgeon will be able to detect and then give a solution. So happy motherhood and save your child. Thank you.